Hi, everyone. Welcome to Embracing Change, a podcast that tells the stories of digital transformation from the individuals that are leading those transformations in organizations. Our guest today is Douwe Bergsma. He's the Chief Marketing Officer. Hi, Douwe. He's the Chief Marketing Officer of Piedmont Healthcare. Before that, he's been in several CMO positions with brands like Georgia Pacific. He spent lots of years in Procter and Gamble, so he brings a lot of experience to the world of marketing. Hi, Doe. How are you?
I'm good. How are you, Gerardo?
I'm very happy to have you here. Thank you for accepting to be a guest.
Yeah, well, thanks for including Piedmont. I'm looking forward to it.
Excellent, excellent. So, just for the benefits of our listeners, would you mind giving us a very brief introduction on your background?
Yes, as you said, I'm Dawa Bergsma. I'm originally from the Netherlands. That explains my name and my accent. I started at Procter and Gamble there after business school. And after a few years there, Procter offered me the opportunity to do an assignment in the United States. My wife and I moved to Atlanta, Georgia for a 2-year assignment. But a year and a half into it, Procter asked me to go to headquarters in Cincinnati, and I did several roles there for about 12, 13 years. And then in 2011, I had the opportunity to become the Chief Marketing Officer for Georgia Pacific here in Atlanta, Georgia, across all of their consumer brands. And I did that for about 9 years. And then about 20 months ago, right before the COVID pandemic, I joined Piedmont Healthcare as their Chief Marketing Officer, overseeing internal and external communications, physician outreach, which is kind of the sales function in healthcare, as well as all of the marketing capabilities.
Excellent. Well, thank you for that, and I totally get your arc of coming to the United States for a couple of years and then staying for longer. I mean, the same happened to me. I was a brand manager in Mexico, then I was promoted to a senior position in London, and I thought it was going to be 2 years, and I ended up never going back to Mexico. So I totally get the.
Here, it was a 2-year assignment, and by now my wife and I have a horse farm here in Georgia. I'm American, and I go to the Netherlands as a visitor.
Exactly. Well, I mean, it's part of the new nomad executive, right?
Yes.
Exactly. Well, the topic of today, of course, our podcast focuses on digital transformation, and I think there's very few industries that are going through bigger transform. I mean, all industries are going through a lot of digital transformation, but in the healthcare sector is particularly interesting, right? Because of the complete 360 influence digital could have around the whole sector, right? From data analytics to telemedicine to user experience. I mean, there's so many areas that we can talk today about. So I'm really looking forward to our conversation. I know that Piedmont has been going through a big transformation, and I wanted to get this out of the conversation as soon as possible, which is you just launched a new campaign, right?
Yes.
Do you want to tell us a little bit about that?
Yes, we a few weeks ago we launched our new campaign with our new tagline, Piedmont, real change lives here. It is the first comprehensive marketing, communication, sales campaign that we have done in several years.
Mm-hmm.
And the objective is to communicate and engage with our patients and consumers across the state of Georgia in a way that it increases the awareness of Piedmont as their potential healthcare provider. It improves the trust that they will have in our system, and it improves the preference they have among the great choices that consumers and patients have in Georgia. Mm-hmm. So that was kind of the emphasis in our brief as we started working with several of our partners. Mm-hmm. Fast forward, translated into a marketing campaign that on the one hand is built to drive long-term brand building and drive metrics like awareness and preference. And then the other hand is designed to drive short-term conversion with metrics like physician visits and procedures with our physicians in the system. On the one hand, we have a marketing campaign that leverages mass media like TV, radio, billboards, banner ads, social media. And on the other hand, we also have short-term activation efforts that are focused on driving people through the experience, that it's easy to book a doctor line, check in before you walk in, have all your information in one place. And if you look at our campaign, and I recommend everybody to look at it, even if you're not based in the state of Georgia, you'll see that we have a TV commercial that embraces the state of Georgia, where we're here to empower Georgians by changing healthcare. And we do that through making the system more accessible, easier to navigate, and have a better orchestrated experience as they interact with us. And that's what our commercial is about. It's all about empowering Georgians by changing healthcare and basically by modernizing it.
Mm-hmm. And really, I've seen the campaign. I think it's really, really good. It really connects to the local customer in Georgia. But really, it's all about communicating all of the efforts that the team has been working on to transform the user experience, right?
Yes.
At all levels. We will talk about user experience shortly, but one of my questions as a follow-up to the campaign is, you mentioned about the objectives being to develop awareness, right? And then to develop or to motivate visits, right? To the doctors and to the facilities. How, first of all, can you attribute, and if you can attribute the behavior of somebody walking onto a doctor's appointment, can you attribute it to the campaign? And if yes, how do you do it?
Yes, so the intent is to make sure that we understand to what extent the campaign plays a role. Mm-hmm. Now, like in many industries, including healthcare, nothing is that single-minded and that linear. It's not you put an ad on TV, or you put a display ad online, or you post to social media, and all of a sudden you can have 100% attribution between that activity and somebody choosing our system over another system. So there is a lot of metrics and measurements. And you can see that the total sum of activities and efforts will have some impact on the total sum of the outcomes. It's harder to attribute individual efforts and separate those and say, and those individual efforts had impact on those individual outcomes. So, for example, on email, it's relatively easy for us to measure the impact of email. You send out emails and people click book, and next thing they show up for an appointment. And you can safely assume that sending out that email had an impact on that activity that consumer undertook at that point of time. Then the question is, to what extent was the email just a reminder of behavior they were already planning on and just pulled it up a week? Or was that email a shift in behavior and plans, and instead of going to another area, another system, they now chose us? That part is harder to determine, but if you consistently measure these things over time, you do a lot of A/B and then test control testing, and you have good benchmarks, at one point you get a pretty good idea while never being 100% perfect. Yeah. But for me, it's also consistency of measures over time. Even if the absolute number is wrong, you can at least see the trend over time, because the margin of error that you have is then consistent over time. So there's a lot of analytics obviously involved, a lot of metrics involved in connecting those metrics. And in some areas like email, it's easier than other areas like PR or as internal communication. So there are things that they're easier to measure and have a better, clearer explanation of the effect. In other areas, it's very hard to measure. I personally think internal communication and external communication is very hard to measure
Of
on the
course.
effect. On the other hand, I think our sales efforts, when our consultants and our liaisons are visiting our doctors and you see the effect within the next few weeks on referrals, that's a little bit easier to measure and easier to attribute. I already mentioned email. Sometimes paid social and display ads is better to track. TV and radio and billboards have their own challenges.
Yeah.
Then you look at, multi-regression analysis, leveraging some of the commercial mix modeling that you see in other industries. But at the end of the day, the key is to have some idea of the value you create through your efforts based on the information you have and the best you can do, knowing that it will never be 100% perfect and that the attribution is not always 100% correct.
Yeah. It's very interesting when you look across all industries. I think the challenge is very similar in the sense of being able to attribute what efforts are actually paying off, right? But what is very, I think, interesting of this new era of more digital tools is the fact that now we have DMPs and data lakes, and we can actually connect the dots, right? I mean, that has other challenges, right? Which is now you need to put a lot of emphasis on data analytics, but now you can actually look at the customer behavior across different platforms, across different touch points of a campaign, and to your point on email, be able to automate the reach out based on the customer journey, right? Based on what ad that person went. If it was on addressable TV, let's say they watched the ad on Hulu, right? And we know that they watched an ad and they read a blog and they opened an email, right? Now we know that that customer is going through a certain journey that grants us to try to reach it out in this way, right? With this offer or with this motivator. And that's something that we couldn't do before as marketeers.
No, you're right. And there is a factor that is complicating these connections and these measurements in healthcare, as it does in other industries, is the role of the personal relationship and word of mouth.
Yeah.
Like in some other industries, healthcare, on the one hand, is going through a digital transformation and all the tools that you mentioned and that we spoke about before. But on the other hand, it's still very strongly driven by relationships, between a primary care physician and specialty care physicians. Like who are you going to refer your patient to often is driven by the personal connection and the personal knowledge that you have of your colleagues in the areas of specialty care, whether it's oncology or cardiology. On the other hand, there's also this personal relationship between a physician and a patient. And so even if you have the best ad in the world, you're going to stick with the doctor that you're with. And if you're very satisfied and a great commercial is not going to change that. Not as it does, for example, in CPG and other industries where you say, hey, I'm using product X. I saw this ad or I have this engagement with this brand. Now I see enough to give the other brand a chance. Now on the flip end, even if you say, hey, because of the experience I have in the digital space or for mass media, I'm considering this healthcare provider. Then on the flip end, you have, somebody else can talk you out of it. They're like, oh no, I know Dr. So-and-so, you shouldn't go to this one, you should go see my doctor. Or your primary physician says, well, I know that you've seen, this cancer center, but I actually prefer that you go to so-and-so. So there is this brand engagement that you have, but there's also person-to-person engagement that you have. And that makes the dynamic in healthcare so interesting.
Of course. I think I was just looking at some research, according to DMN3, that shows that the customers, 40% are researching doctors online, 38% are researching hospitals and medical facilities, and 77% are actually booking medical appointments are used to or are expecting to book medical appointments online. So I think if we talk a little bit about the user experience, right? How users experience um, the healthcare sector, and you and I, we talked about customer expectations as well, right? How is the in a world where people are used to ordering what they want to eat online, to get an Uber or join a meeting on Zoom or being able to um, order anything they want from Amazon. All of those standards have created expectations for us as customers of any industry, regardless of how digitally transformed they are. So I guess my specific question to you regarding the healthcare industry is, what are the new customer expectations for healthcare? Is there anything that you can share with us
Yeah,
that?
yeah. So I would rephrase the answer to your question is these are not specific expectations people for healthcare. These are expectations that are changing for society overall.
True. Agree.
And obviously, in some industries, they have led in a way that those expectations have changed.
Mm-hmm.
And other industries followed and lived up to those expectations. And then in healthcare and some other industries, they still have a little bit to go to get there. So nowadays it's easier. For example, let's say if I want to go to New York, let's say I want to go to a certain hotel in New York next week. I can do everything online. Actually, I can everything on my phone. I can, order an Uber or another drive share to the airport. I can book my ticket to the airport. I can check in at the airport. I actually have my security on my phone.
Mm-hmm.
Then I arrive in New York. I do another ride share app. Maybe Lyft when I'm in New York. I go to the hotel and I book the hotel on one of the many sites and I check in. And sometimes I can even use my phone as the key to my room.
Mm-hmm.
I can do all of that without a single time making a phone call or talking to somebody.
Mm-hmm.
We're not fully there yet when it comes to healthcare, where of course you still want to talk to your doctor eventually. Very different from you don't expect to talk to the pilot, and you don't expect to talk to the hotel owner, or and I don't think you can avoid talking to the Uber driver.
Yes, of course.
But in healthcare, in the end, you want to have an interaction with a clinician or with their staff member. But the process to get there is very mixed, and often you still have to pick up the phone and make a call, and they call you back and they reschedule. You'll get there, you have to fill out a bunch of papers, the clipboard, and you're sitting there filling out these same papers, wondering why you're filling this out again, because you already did last time you were there and the time before that. And so there are some experiences within healthcare that are not in line with what you see in other industries. But because of those other industries and those other experiences, consumers come to expect, and those experiences in healthcare and some other industries all of a sudden stand out because, well, why is it so easy for me to book a hotel room or a flight or a cab or a restaurant, and why is it not so easy to book my doctor or to book my appointment? Now, it's rapidly changing, and a lot of systems are embracing this thinking and moving forward. But there's still some opportunity for healthcare providers to get there. And Piedmont, when we talk about transforming healthcare, that is literally the transformation we're talking about. Find and book a doctor online, have the ratings and reviews right there. When you search for something, we need to show up on the search engine. And when you engage with our doctors, you make your appointment online, you walk in and you're already checked in before you walk in, and you hold up your phone and say, hey, listen, I already checked in. You don't have to fill out all the clipboard papers. Your insurance information is uploaded, maybe your credit card already prepaid. And then, when the results come out, you'll have your Piedmont My chart where all of the information is one place. You can text or you can email with your doctor right from there. That is kind of where we're going, and that's talking about the campaign we talked earlier. That's what we want to emphasize and make sure that our patients and consumers understand we have those capabilities and that we're offering that experience as we speak. And that the experience that they have in other industries around them in society actually is now available within healthcare.
Oh, wow. Okay. So this is something that it's not coming in a few years. This is something that we're now able to deliver.
Yes, many healthcare systems, and of course, Piedmont is there. Not for everything, if you have a liver transplant or you have a stroke, that experience is very different.
Of course.
Like times with the urgency, you need to call 911, and so it differs by the service and the urgency and the distance. So there are a lot of variables, but let me put it that way. It's not available for everything, but it is available for way more things than people currently believe there are.
So there is something about, and this, to me, I think it's really well connected to the concept of big data in healthcare, because we need to be able, in order to be able to provide that customer experience, you have to be able to connect all of that data and make sense out of that data, right? So there's something about big data aggregation that I think is very transformative for healthcare, and I'd love to hear your point of view on that. But through big data, we could lower the rate of medical errors, right? Because now we know what trends we're looking at trends, and we're being able to analyze those trends, right? We might be able to facilitate preventive care, because we know if somebody came to visit, their doctor certain months ago, it's due now time to come back, right? There could be more accurate staffing planning, right? Because now through connecting all of the dots, we know how people are behaving. I think there's something about that, and the trend of wearable devices, where through wearable devices, and I don't know to what extent, but if they are interconnected to these big data lakes, doctors can now then be looking at trends and looking at behaviors of their patients and predict when a patient probably needs to come for their next visit, or maybe needs to be reviewed for their medication. How far away are we from that world where patients and doctors are interconnected through data, wearable devices, etc.?
Great question, and it's not an easy answer. There are so many variables that play into that. On the one hand, there's several laws that protect the privacy of our patients. So that obviously that plays into it. On the other hand, it's how clean is the data, how advanced are the platforms, to what extent will consumers and patients opt in and voluntarily have a relationship where data flows freely. And then on the other hand, like how clean is the data and how accurate is it? So there's a lot of questions unanswered, but based on what you've seen around you and what you see in other industries, it's not too far-fetched to believe that future is one of the potential options if society chooses to go down that route. But if you're asking me how far are we, it's mixed. On the one hand, we, for example, use AI when we're dealing with a stroke. And leveraging AI and a huge worldwide database to look at similar variables and then narrow it down to this patient has these variables. This is the patient information. So it is most likely that the patient has this procedure as the most successful one for them is already there. And it shaves off maybe seconds of the treatment. But in a stroke situation, seconds can be the difference between life and death.
Of course.
Very advanced, tapping into worldwide information and data and making and sure that the doctor has the best tools and the best knowledge available in the fastest way possible.
Hmm.
Well,
Hmm.
that's already there. On the other hand, we have robots cleaning hospitals. That
Yeah.
already exists.
Hmm.
But I'm not aware of, some areas that you mentioned where, information flows freely between, the patient's iWatch or Apple Watch and the practitioner, where the practitioner like, oh, there's a lot of red meat in this diet. Let me ping them with a warning about eating more heart healthy.
Yeah.
Um, but you can imagine that's possible, but there's a lot of things that go into, on the one hand, laws, consumer choice and opt-ins, and then obviously the technology and the process capabilities that are out
Of
there.
course. Of
But
course.
in the end of the day, I think as a whole, healthcare system, society needs to balance what's technically possible and what is humanely reasonable.
Hmm.
Because data privacy and protecting your information and your data is also a priority, and you need to balance
Of course.
your health and wellness with protecting the information of you and your family.
Of course, of course, and to that point, and I know it's not here just yet, but to that point, I think blockchain might play an important role. Uh, Totally different to the idea of Bitcoin, and I know that is, there's a lot of arguments for and against, but the technology of blockchain could be probably one of the triggers that help better protect data, and data privacy, that would allow this type of communication between devices and physician systems, right? So it's interesting in the next few years how that's gonna be evolving. I think if you connect the dots, it's gonna happen. It has to happen because now we have the ability to, through opt-ins, right? And maybe it's not for every condition, but maybe if there's a patient with high cholesterol or with diabetes or with a certain condition, they will opt in to be monitored through a wearable and receive messages from their doctors, right? Maybe
Yes.
not for not maybe not for a healthy person, but the conditions are there for it to happen. It's just logistics now in terms of data privacy. I'm not trying to minimize it, but there's gonna be a technological solution for that
Oh
at some
yes. No.
point.
No.
Somebody's
Yeah.
gonna make a lot of money finding
Yeah.
a solution for that.
Yeah. And as I started there before, it is mixed, and it very depends on the situation.
Hmm.
And in some situations, we're already monitoring, and in other situations, it's not going to happen, and there's a lot of variables that drive that.
Hmm.
But I think overall, if the technology serves humanity in a way that it improves your life and it improves your health, there's a huge benefit to that. You
Yeah.
need to balance that with the potential downsides, and things like blockchain and other, future technologies might help us on protecting against fraud and freely sharing of personal information. And like many things in society, it's balancing the pros and cons, the potential upside and the potential downside.
Yeah.
It goes all the way back to things like flying and electricity. And I'm sure they have debates there, like, well, if you start flying, there will be, airplanes that will have accidents. And if you have electricity, somebody's going to put their finger in the box and get
Yeah.
shocked.
Yeah.
So yeah.
um so moving on to a different topic, and you and I had this conversation when we were talking about the podcast, when we were prepping for the podcast, and I think this is something that it's so interesting about the challenges in the industry, right? Which is uh, the balance between digital modernization of the user experience, the tools, etc., with the role of the community health provider, right? Because at the end of the day, healthcare is very human. I mean, you're dealing with nurses, you're dealing with doctors, you're dealing with your health, and you're fragile and you're concerned. There's something that is very, very connected and human about it, but we're trying to transform the experience through tools, right? But can you tell us a little bit more about how to balance those two things, right? The fact that there's a community role of healthcare, but then there is the digital modernization that needs to happen to healthcare.
Yeah, I would say there's a healthcare provider, depending, it kind of depends where you are as a healthcare provider. It's a bit different if you're an individual doctor's practice or if you're a large healthcare system or a local hospital. But for Piedmont, free, there's kind of free, of the many roles, there's free very important in there. First and foremost, we are a healthcare provider. That's our reason for being. And that is mostly about a person-to-person relationship between the physician and the patient. There's an emotional and a functional connection. It's about quality and compassion. It's about healing and addressing an issue. So that's one role that you have. The second role is the role that you as a healthcare provider have in the community. And a system like Piedmont often is one of the largest employers in the community. We're often one of the largest customers for many other companies in the community. The healthcare situation and the healthcare provider plays a key role in the standing and the image of the community. For example, if you're a developer, you would like to make sure that where you're developing your houses, there's a good healthcare system and a good school system in the neighborhood. It kind of makes a big difference. And that is more, while the healthcare provider role, I guess, is more person to person, this is more organization to community. It's more abstract, but very important. And the third role is more of a service provider, where the first role has similarities between, you know, a client and a lawyer, or a client and a financial advisor. The second role is more like the community has with schools or with churches or with the government and with their healthcare system. The third role is more of a service provider, where there's a lot of similarities with hotels or retailers, where you say, hey, I need something and I want it to be convenient. I want it to be simple. I want to be interacting with confidence and, you know, at the right time, at the right place, where I choose to. And that is kind of the area. And it's more person, the patient, to the organization. And it's so the clinical experience is more person to person. The system experience is more system to person. And in that last role I'm describing, that's where there's a huge opportunity to mimic and to follow where society is, as we talked earlier. Why wouldn't the experience with the healthcare system, when you need to book an appointment, when you need a flu shot, or you need a COVID vaccine, or you need an appointment with your physician for your annual health check, why wouldn't that experience be similar to booking a ticket on your airline, like Delta, also based in Atlanta, or when ordering something at Home Depot, also based in Georgia, or ordering a chicken sandwich at Chick-fil-A, also based in Georgia. See how we are trying to empower Georgia?
I love it.
And that is the area where I think the digital transformation and the modernization plays a key role. The person to person will always be about human relationships between you and your doctor. The community to system will always be about us as a large organization and the key role we play in our surrounding community in many areas. And then us as a service provider, we try to become more like other service provider, whether it's your grocery store or whether it's your hairdresser or whether it's your bank, it could be your healthcare system, and the experience should be similar in that area. There's many more other roles that we play, obviously, but in those roles, there is a different role to play for the digital transformation. That last role that I mentioned is where we try to excel and transform healthcare.
Of course.
But it's not either or. You have to be a community player, you have to be the healthcare provider, and you have to be the service provider where you have easy access and a smooth, integrated, orchestrated experience.
Of course. I mean, in this case, really digital, what it's doing is amplifying that community service, right? It's making it's simplifying the journey, simplifying the access, but it's amplifying the benefits and that compassion that you talk about and that service that is provided. What are the organizational challenges to to this transformation?
Yeah, well, the first is change in general for very established industries is always a challenge.
Mm-hmm.
And I'm in healthcare only for 20 months. But it does remind me a lot of the transformation that retail went through several years ago.
But what 20 months? I mean, I know you joined this job like a month before COVID
Yeah, I
started,
had
right?
four what I would call regular weeks,
Uh-huh.
where I was going through like the onboarding and the compliance training and getting to know everybody. And so I started early February 6th. March 7th, we had our
Uh-huh.
first COVID patient and the world changed. And we've been living in that. So I actually don't know what it is to work at Piedmont under pro-COVID circumstances because I
Of
haven't
course.
experienced it yet.
Of course.
But it has been a thrill ride, yes, for sure.
Sorry, I interrupted you. You were talking about the organizational challenge. I was just going to say that organizational challenges in established industries are uh, both competencies. What we're seeing with our clients, right, it had to do with the competencies, the skill set, but it also have to do with the culture. And I assume it's going to be the same for healthcare. And one of the things that we've seen is that there is this tendency to for people that have been for a long time in an industry to try to straddle. Some industries are getting disrupted, right? And most of the income is coming through a certain channel, through a certain process, and they know that they need to address the future because there's disruptors, there's a change in the industry, but they're trying to straddle between the dangers of it and what they need to be doing for to address the future opportunities, but they're struggling with their current sources of income, the current sources of revenue, right? And this is happening across industries, and it's happening, and it's what's really the companies that are being able to straddle that efficiently and move faster to that future reality are the ones that are being able to stay relevant and survive, right? Is that something that it's playing out too in the healthcare industry, or do you feel that that's not a challenge just right now like it's been for other industries?
Yeah, it's. I need to be careful not to talk about the industry as a whole, as my experience is limited to Piedmont and
Yeah.
what I see from the outside and others. But assuming there are similarities between Piedmont and other healthcare systems, we have challenges that are similar to other industries, of course. In general, change only happens when three things are true. Now, first and foremost, people need to have some level of dissatisfaction with the situation they're in. What is the problem? So that's one. The second thing, even if you're not happy with the current situation, you also need to have an idea of what a better state would look like. What is the vision of the future? What would a better state look like? But if you have dissatisfaction with the world you're in or the current situation, and you have a vision of a better state, you still need to see a reasonable path to get there. And this is called the human action model, which was applied with my former employer, Georgia Pacific. Part of Koch Industries really embraced that in their day-to-day management philosophy. But those three things have to be true, dissatisfaction with the current state, a vision of a better state, and then a reasonable path to get from the current to the better state.
Mm-hmm.
And in healthcare, it's kind of mixed. You have individuals that don't see there is a problem, or are not dissatisfied with the current state. We've done this for 100 years, and why couldn't we do this for another 100 years? Or it's kind of like, I don't know what the problem is. Patients are patients, and it's all about referrals, and it's all about personal connections and people to people. So that's one challenge that you have is like, are we all aligned to the potential problem that we're having? So that's one. And the second one is then, what is the vision of a better state? What is that future state that we would like to go to? And again, once that is stated. And once you have that, is it a vision, or is it an aligned vision? Is everybody agreeing on that? And then the last thing, do you have a plan? Now at Piedmont, I think there's mostly a agreement on that we need a change. Hence our slogan is "Real Change Lives Here." Our leadership has been pretty clear way before I came. We have our strategic framework. We call it Plan on a Page, and clearly states this is where we want to be in 2026. We want to transform healthcare to have the best clinicians from a quality and a compassion perspective, and we want to have a forward-leaning and most engaging experience for our patients. So that's clearly stated, and then we have a path to get there. And in order to get there, you really need to make sure that you clearly lay out what the strategies are, what the priorities were in the strategies, and assign people to that to make it happen and push from the top. Now, what I really like about our CEO, Kevin Brown, is he also puts numbers to the words. So he basically has clear vision. This is where we want to be in 2026. This is what our strategic framework is. These are the priorities. These are the metrics for each of these priorities. And this is who's responsible. And that's what you need to go. Now, so you check off these boxes. Yes, we have alignment on the problem. Yes, we have alignment on the vision. And we have a reasonable path to get there. Now, but within that reasonable path, there's a lot of leg and footwork that needs to happen.
Behaviors. Action.
Behaviors that need to change. It's one thing for leadership to say this is where we're going, but if you have 2,500 doctors and almost 28,000 employees across 800 locations who all joined the systems at different points in time, it's not like some of these companies that are founded and are expanded and maybe acquire some others. Somebody told me once, say, listen now, when you're in healthcare, most of the doctors started out as an entrepreneur with their own business, their own practice. Somewhere along the way, they chose to join a larger system, and they went from being an entrepreneur to becoming an employee of a large organization. So they go from their standalone practice to being part of a multi-billion-dollar system. But their DNA hasn't changed. So now you have that tension between I'm a physician / entrepreneur with a high level of independence, who now all of a sudden is an employee of a multi-billion-dollar organization. And culturally, that does take some work on both sides to then pursue this path forward. And it's 3 steps forwards, 1 step back some of the times. Some of the times you basically say, listen, this really works for the system as a whole, but not for the individual staff members or the individual practices or the individual physicians. And then you try to adjust. But the most important thing is that collectively you try to move forward on a path that puts the patient central, that is consumer centric, and basically does everything you can to make a positive difference in every life we touch, which is our purpose. So it's, on the one hand, we have our purpose, make a positive difference in every life we touch. And the other hand, we have our vision and our mission, where we say, listen, we're going to transform healthcare to be the best clinicians with a high level of quality and compassion, while delivering a forward-thinking, one-of-a-kind experience. And there's no misalignment or problem on the first part of that transformation. There's not a single person who doesn't be the best clinician and the best quality and compassion. On having changed that experience, which includes embracing a lot of digital tools and frameworks and processes, that's where you see the friction, because the first part of our transformation does not always fully embrace the second part of the transformation.
Of course.
Because of the history and the experience that many people have. Add to that, no patient is the same. So just like in travel, there's still people out there that use travel agencies. Not a lot, but they're there. And there's people that even don't know what a travel agency is, and they
Hmm.
don't know how to book an airline ticket without their app.
Hmm.
And in healthcare, the population of patients skews a little bit different than society as a whole,
Hmm.
because the as you get older is when you get more healthcare issues.
Hmm.
So our population skews older. Our populations is also very much dependent on where your locations are.
Hmm.
So, and those demographic and geographic differences, as well as some other attributes, play into the preference of the patient.
Hmm.
But we have patients out there where it's still important that you pick up the phone and they can walk in and talk to their doctor, and that's how they make an appointment. And you
Hmm.
have patients that basically sitting, at work and at 10 o'clock at night want to be able to make an appointment. And you need to cater to all of those, because if you're patient centered, you're centered around all of your patients and try to meet the needs of each individual patients in
Hmm.
the most effective and efficient way that you can.
Hmm. Hmm.
Long answer to a simple question, I
Very
know.
long answer, but it's a complicated it's a complicated topic for any large organization. I love the framework, by the way. I wrote notes on the framework. The first, understanding the dissatisfied state, having a vision of an improved state, and then what is the path to get there, right?
Yes,
I mean,
called the human action model. It's one of the fundamental beliefs that Koch Industries uses in their management philosophy.
of course, I know, I love it. I love it. Um, Funny enough, it's similar to the type of I'm going to digress here, but when I talk to clients and I'm in business development mode, right? I'm trying to understand what their pain is, and I'm asking them about what would solve that pain. So that's a vision. So the pain is what the dissatisfaction, what would solve the vision, and then I talk to them about a results mechanism, right? So how we can help them relieve their pain and get to where they need to be, right? That which is very similar process to what you
Yes,
just described, but in a sales environment, right? So
yes,
anyway,
and correct me if I'm wrong, but you often see, and I see it here. I saw it at Georgia Pacific. I saw it at Procter and Gamble. Is that the dialogue and the requests or whatever conversation you have often focuses on the path to get there fast. It's always like, I'll give you one example. I would have a physician send me an email and said, "Listen, I want to do an ad in a newspaper, or I think
mhm,
I need to have more social media posts." And we're talking about the reasonable path to get there, and the question is like, well, what problem are we solving for, and
yeah,
what is the vision of your future state? Because what you're asking might or might not be the good solution for that.
yeah,
And in general, we often skip the problem phase. Like, what is our problem statement, or how will we define the challenge that we see? And often it's not sufficient to say, I need more patients or I need to sell more. It's kind of like, okay, what is the
yes,
goal? What is your
uh,
status? What is the barrier? What is the insight? What is the consumer perspective? What does the data say? We kind of tend to go to the part that is easier to discuss. I said, no,
yeah,
no, let's get a line on the problem first.
yeah.
And then when we have that alignment, let's align on the vision and the path forward first.
And then the
And then let's
solution.
talk about the solutions and the tactics within those solutions.
Yeah.
But that's
So
that's the harder part, but that's where people like you and me hopefully can play a key role.
absolutely, and you're absolutely right. Normally, when somebody comes up with a pain, somebody comes up with me with a certain pain that they're describing, business pain, right?
Mhm.
Normally, what I try to do is to scratch the surface, and because normally, what they are describing the first time, most likely, it's consequence of the real pain. But if you go further down 2 or 3 questions asking why, what if you're curious and try to understand what are you trying to solve, is that really your problem? And you realize that actually the problem is different, right? And they realize that actually what they were trying to address was like a little piece, but there's something more fundamental that they need to solve, right?
Yes.
That they need to address. And that's when then it becomes very interesting, because now you're talking about a fundamental issue that you can solve, and it's going to actually, you're not talking about tactics anymore. Now you're talking about strategies and solutions to achieve certain goals, right? So when a physician is saying I might want to have more social media posts, maybe the real pain is I don't see enough people coming through my doors, right? So let's try to figure out why is that happening. It's not going to be solved by more social media. It's going to be, maybe it will require a different set of tactics, right? So, to that point, you're absolutely right. I mean, it's interesting. It's interesting that process of problem definition and vision definition, that it's very, very important before we can then go into plan definition.
Yes,
Yeah,
yes.
absolutely. Listen, this has been a fascinating conversation. I really enjoyed all of your experience. Enjoyed learning about all of the great things that are happening at Piedmont Healthcare, and also at the industry in general. What's coming for customers. I want to thank you, Douwe, for giving us your time.
Yeah, well, thank you for including Piedmont. We always love to talk about, how things are changing. After all, Piedmont, our statement is "Real change lives here,"
Uh-huh.
and I'm very thankful that you included us in your efforts, and looking forward to further conversations.
Excellent. Thank you so much, Douwe.
Thank you.